everyone, I'm Jen.
And I'm Joe.
And we're Jen and Joe
on the go. So, I'm a little nervous about this one, Jen. Where are we going this time?
Well, I'm not going anywhere, but why don't you sit down and you can tell us where you're going.
Oh man, I'm going straight to The Walking Dead. That's what I think I'm doing.
Okay, Joe. So, where are you going today?
I'm going to the hospital, Jen.
Why?
Not to work.
Well, why are you going to the hospital?
So, as everyone knows, this week they released the COVID vaccine. So I have volunteered. The hospital is not making it mandatory, but I have volunteered to go and get it. So, yeah.
So how many doses is it?
This is the Pfizer, so it's 2 doses, 3 weeks apart. Years ago, when I did the hepatitis B vaccine, those were 3 doses done at a couple month intervals. So that was like 30 plus years ago. So this, obviously, well, you know, people are nervous about it simply because they push this out so quickly. So if you're going to believe the experts, just the same as we've tried to believe stuff all year, you got to listen to these experts. Yeah, I mean, this is supposedly safe, so... So
you're a tier 1 hospital worker.
Yes.
So that's why you're allowed to get the vaccine.
Right. So they've broken it down in Illinois. They finally got all of the shipments out earlier in the week, and so you have to set up an appointment. So I did that for today. I'm not working, but I'm going in. So why don't you come along? We're going to document this and see how I feel throughout the day today, and hopefully I don't turn into a Walking Dead zombie.
My big question is, I want to know, because it has to be stored at such a cold temperature, I want to know if it feels cold going in.
Yeah, I know.
And then, so your appointment's at 10:30 this morning?
Yes.
So I think we should check back with you about, 2 hours later, and then around 12:30ish, and then we should check back with you later this afternoon or maybe this evening to see, just because I heard, people are having some side effects, so I just want to see how you're feeling.
Yeah, just to see how bad I get. Am I going to have a headache? Am I going to have the diarrhea? Am I going to be puking? Am I going to have aches and pains? Am I going to be bleeding from the eyes? I don't know. We'll see.
Let's hope not.
Yeah, I know. The other thing I'm nervous about is like if anything happens with this, if you have any kind of side effects, you can't sue Pfizer, you can't sue the US government, you can't sue the FDA. So basically, if you're screwed, you're screwed. So
all right, Joe.
Come along, won't you?
Good luck, and I can't wait to hear all about it because I will be staying in our house in my pajamas.
Yeah, all right, lucky you. All right, talk to you later.
Bye, Joey.
Hopefully. Okay, I'm here. I made it. I am at the hospital. I have about 10 minutes before my scheduled appointment, so I'm going to head in. I'm not going to bring the camera in to record while we're doing this, just simply because I'm in the hospital, but I will try to get a picture or two while we're doing it, and then I'll let you know how it is when I get back to the car. Yeah, the concern here, it's funny because throughout all of this, I really haven't been that concerned about the virus. I've worked in healthcare for over 30 years, like 33 years, almost 34. So we've dealt with issues and problems and viruses and illnesses, and it's universal precautions. So we've tried to be careful throughout all of it. This year has been a serious one, but I haven't really been that worried about the illness. So we'll see. The vaccine, on the other hand, because it was pushed through so quickly, but from what I hear, again, we have to trust the experts. They built this vaccine off of what they've already had and what they've already known. So there are new aspects to it. But anyway, we just have to have some faith, right? And that the experts are leading us and guiding us in the right direction. So we'll see. I'll let you know. I'll check back in when I'm back in the car. And just like that, I'm back in the car. All right, well, I survived. I'm not a Walking Dead zombie, not yet anyway. So just the initial reaction response, the way they've got things set up here at the hospital, very organized. Just the whole process of explaining everything, not just with the handouts and information that we received there printed, but also then the nurse who was administering the vaccine was very thorough, explained everything step by step. Explain some of the different side effects, which we'll go over a little later, but explain some of the potential or possible side effects anyway of this. So my response to it, or at least my take on it, was that with all the different flu shots I've had over the years, I've never had anything that felt like this. It was definitely cooler than anything else. Apparently, the medication, the vaccine, needs to be stored at 80 degrees below zero. And then it is shipped through a process where it's stored in dry ice. And then there's a storage facility here at the hospital that will keep it at the proper temperature. Then it has to be reconstituted and thawed while it's thawed out. And then the nurses have a certain period of time to administer the vaccine before it's no longer effective. So they have everything cataloged, and there is a certain time where that's it. Once they've reached that time limit, whatever vaccine is still out there, they have to throw away. So they work through it because of these scheduled appointments that they have. They know exactly how many they're going to need, so that basically there's nothing that's wasted. Other than that, then actually getting the shot itself, my arm felt kind of like that cold burning that you feel, almost like if you put like icy hot or something like that on your skin. That's what it feels like from the inside out. It's kind of that hot, that cold, hot, cold burning. But it doesn't feel bad. I mean, other than that, I feel fine. Said some of the symptoms might be headache, dizziness, nausea, fatigue, muscle or joint aches and pains. I said to the guy, I'm like, yeah, that's what I feel like all the time, normally. But anyway, so that's it for now. We'll check in a little bit, maybe in a few hours, just to see how I'm doing. I'll let you know how I'm doing a little later today. So far, not a zombie, so that's good.
Okay, everyone, so it's been about 6 hours since Joe had his COVID vaccine, so we're going to check in with him to see how he's feeling, if he's had any side effects, if his arm hurts. So come with me and join me as I interview Joe, round 2.
Well,
okay, Joe, so it's been about 6 hours since you had the first dose of your COVID vaccine. Is your arm hurting?
no, I'm still kicking.
How did it feel when you got the shot? Did it, since it's stored at such a cold temperature, did it feel icy cold going in?
Yeah, not icy cold, but it was cold. So my whole arm throughout the day, well, not my whole arm, but my upper arm felt like icy hot. So it was that cool kind of heat. Mm-hmm. So I've had flu shots for many, many years, and usually the site of the injection is sore for a bit, especially the next day. Here it just was odd because it felt cool in my upper arm throughout majority of the afternoon. So the first few hours. Now it feels fine. There's like nothing. Also, today was just an odd day. I woke up, my sinuses were really bad today. I usually have sinus issues in the winter. So I just have felt really just a lot of pressure.
But nothing from the COVID.
But nothing from the vaccine. No, this is all just regular. I woke up with this, and still even now I feel very nasally. And I took Advil, but anyway, I can't do any kind of sinus meds. It all knocks me out. So I just do ibuprofen. But anyway, so I'd mentioned earlier, the whole process was very organized at the hospital. So because the vaccine needs to be stored at 80 degrees below zero, when it leaves wherever it's coming from, warehouse, wherever, it is shipped in dry ice. When it arrives at the hospital, they have special storage facilities to keep it at that cold temperature. When they bring it out, it's reconstituted and thawed out, and they have a 5-hour window to use the vaccine.
Oh, that's interesting.
So that's why it has to be scheduled. So that way they know they're going to need this many vials of vaccine because we have this many people coming in. If they don't use that vaccine within the 5 hours, they have to throw it away. So they don't want to waste any of it. That's why they have to schedule everything. So as I went in, they went through and gave me all sorts of information. Fact sheet for recipients and caregivers, talking about what you need to know before you get the vaccine. It explains what this Pfizer COVID-19 vaccine is. So there is quite a bit of information here about the vaccine, including what are the risks and some of the side effects they talk about. Injection site pain, tiredness, headache, muscle pain, chills, joint pain, fever, injection site swelling or redness, nausea, feeling unwell, or even possibly swollen lymph nodes. And this can actually happen the day of or within a couple of days. But the only thing I could say today is that I have felt a little off, like not nauseous and not tired, but just kind of, and again, it could just be the sinuses. So I'm not going to say that it's anything from the vaccine.
And when do you get your next dose?
So the next dose, this is the 2-dose one. Moderna has one that is 1 dose, and that was just recently approved, I think, yesterday.
It was.
But the Pfizer one is 2 doses and it's 3 weeks apart. So I actually have my appointment set up for 3 weeks from today. I'll go back in to do it. I do have a card that comes with it, and it just basically is, I don't know if it's my get out of jail free card, I'm not sure, but it does actually confirm that I did receive the vaccine. So that is it. I mean, overall, it hasn't been bad. If anything does happen within the next few days, I can pop back in and we'll give an update. But
if not, we're going to assume that you're okay and life is good.
If you still see us making videos and I'm still in the videos, and it's still Jen and Joe on the go and not Jen and the hen hanging 10, then you know I'm still kicking.
Joe.
I'm still there. And then the other stuff that they gave, there was one sheet that actually talks about the dosage itself with the lot number and who gave me it.
Oh, that's interesting.
Yeah, so there's a lot number. There's information specific about the vaccine, the lot number, the NDC number, and then also the hospital gave us information if there are any side effects. Or if you're not feeling well, you could always call them and speak to a nurse. But they did say ultimately if it gets to be anything severe, go to the ER, but that's just said to kind of cover.
So again, just
yourself.
to reiterate, you are a tier 1 healthcare worker. That's why you were able to get the vaccine right away.
Yes.
And now your hospital is out of vaccines and they have to wait to the next shipment?
Well, they had a certain number and they basically had enough to cover what they needed to do for, I think, tier 1 and tier 2.
Okay.
So they made all of those appointments that go through tomorrow. So they've used up, basically with the appointments tomorrow, they'll have used up all of the vaccine that they received. So now they have to wait for the next shipment to get to other people who might not have as much exposure to COVID patients. So,
Gotcha.
Yeah. And so it's a slow rollout. You can only make so much, and you have to roll it out to get it to everybody. So eventually, we'll get to more people, but right now it's healthcare workers and elderly.
Well, thank you so much, Joe, for sharing this COVID vaccine process with us. It's been very informative.
I'm glad you enjoyed it, Jennifer.
I did, Joe.
So don't forget to like and subscribe and hit that notification bell, because you never know what you're going to get on our channel. Could be a little bit of Disney, could be a little bit of drunkenness, or it could be talking about the COVID vaccine.
I know. Well,
and how one of us was fortunate enough to get it and one of us has not gotten it.
I'm going to assume fortunate enough, but we'll see. Time will tell. I'm still thinking Walking Dead. I don't know, but all right, dear. I did it for you, ultimately.
Oh, thank you.
All right. We'll talk to you guys later.
Bye.
Bye.